Good afternoon. I'm Lauren Blanchard, president of the University of Houston Downtown. I want to thank you for joining us today in an ongoing discussion about something that's certainly been top of mind for all of us, and that's health and safety. This topic has been at the forefront of our attention in recent years for one undeniable reason: COVID-19. The outbreak, as you know, was first reported in December 2019, now heading into its third year. We all wonder, where does COVID-19 actually stand? How do we stay safe and healthy? What can we do to protect ourselves and one another? And what comes next for the pandemic? These are really important questions, certainly for you and your families and for the University of Houston Downtown community. And we're very mindful of these concerns. We've taken steps like implementing flexible work and class schedules and providing PPEs and hand sanitizers in high traffic areas. We've provided COVID-19 vaccinations on campus. We've hosted a curative testing kiosk 7 days a week, right beside the Jesse Jones Student Life Center. But still, even with all of these measures taken, there are questions and concerns, understandably so, which remain, and we hope to be able to address during today's conversation. Through a combination of our staff experts as well as our community partners, I'm confident that we'll be able to provide some answers to these tough questions today. We're so fortunate to have working with us and who will serve as our moderator today, Ms. Cynthia Vargas. She will guide us through a discussion with our guest speakers to navigate through these challenging topics. Ms. Vargas, thank you so much for moderating today's webinar. And thanks so much for all that you do for the University of Houston Downtown campus. I'll turn it now over to you.
Thank you, President Blanchard. Good afternoon, colleagues, students, and friends. Welcome to our COVID-19 Health and Safety Forum. My name is Cynthia Vargas. I serve as the Director of Emergency Management here at UHD. I'm honored to be here today to moderate this important conversation. Now, this series is a vision of President Blanchard. It's an ongoing effort to share information with the campus community about health and safety topics that are related to COVID. As you know, COVID continues to ebb and flow and continues to pose an ongoing threat to our local community. And although conditions are currently improving here locally, we still need to remain vigilant and informed as a campus community. And we need to continue monitoring the ever-evolving conditions around us. So joining us here today are two experts on this subject. We're very pleased to have them both with us. So let me go ahead and introduce them to you. First, we have Ms. Imelda Garcia. She is the Associate Commissioner of Laboratory and Infectious Disease Services at the Texas Department of State Health Services. She has more than 10 years of experience with the State Health Department, where she has held several key positions, including Director of Community Health Services, Director of Community Infectious Disease Prevention. In these positions, she's overseen and has overseen prevention and control of activities for emerging and acute infectious diseases, tuberculosis, HIV, STDs, as well as programs for child and adult immunizations, family planning, and breast and cervical cancer services. In recent years, Ms. Garcia has been involved in response activities for Hurricane Harvey, Ebola, Zika, as well as other infectious disease outbreaks. She began her career in public health at the New York City Department of Health and Mental Hygiene, focusing on infant mortality reduction. She's a graduate of UT at Austin and holds an MPH from Columbia University's Mailman School of Public Health. Also here with us today is Cory Worden. Mr. Worden is the Safety Administrator, City CBRNE Advisor, and Safety Advisor to the Houston Health Department. Cory has more than 17 years of experience in safety and has written 9 books. His work has been published by the American Society of Safety Professionals, the Association of Occupational Health Professionals in Healthcare, the Institute for Safety and Health Management, the National Safety Council, and others. Cory has been was the 2014 ISHM Safety Professional of the Year, a 2015 National Safety Council Rising Star, the 2016 ASSP Health Practice Specialty Safety Professional of the Year, the 2017 AOHP National Extraordinary Member, the 2018 AOHP Extraordinary Service Award recipient, a 2020 Houston Health Department Excellence in Community Service recipient, and a 2021 City of Houston Bravo Award recipient. This in addition to being the recipient of numerous military medals and awards. He's presented at numerous organizations, as well as the College of Mainland's Gulf Coast Safety Institute, among others. We're extremely fortunate to have both of these experts here with us today to talk about these important topics. Now, before we jump into any questions, I want to remind all our viewers that you can pose questions at any time using the Q&A button down at the bottom of your screen. At the end of the this symposium or this forum, we're going to have time to take quite a few of those questions. Now, for Cory and Imelda, this is going to have a very conversational tone. You're invited to answer actually any and all of the questions, and we'll just have a relaxed dialogue. If you guys are ready, we're going to begin with our first question. Cory, I want to start with you. Can you start by updating us on the current COVID-19 conditions here in the city?
Sure. So it's interesting how things have gone, because there's been a significant change in the last several months. As we all know, when the Omicron variant had come about in the winter, then that brought with it a very high infection rate, and then with that, there was a significant increase in the communicability of the virus, and there was also a significant change in the CDC's recommendations, meaning that when we're talking about source control or face coverings, the CDC went from recommending surgical masks and regular face coverings all the way to N95 or K95, which is the international equivalent in most regards, respirators. So the big difference being that in normal operations, such as healthcare, EMS, laboratory, areas where they're working with known inhalation hazards, then we would use an N95 respirator as respiratory protection to actually filter contaminants. Whereas with source control, the intention is to contain the user's droplets. And so when the CDC went to recommending those, then that of course made a big difference there. So they were requiring a lot more rigor behind the source control. However, as time has elapsed in the last several months, the infection rate has dropped significantly. Of course, it's variable, but just to put it in context, it went from 53% down to 3%, so to speak. And so within that same context, of course, a lot of the protocols have changed with that. So the interesting thing is that we're now kind of at a place as a collective, as a people, where COVID-19 is really being treated much like we treat influenza every year when we have the winter, influenza season. So what that means is that there's, of course, there's COVID-19 vaccines that are available. And then from there, a lot of the requirements and a lot of the mandates are no longer there. There's not a lot of requirements to wear masks. I know the city removed that policy for city employees a couple weeks ago. The Mayor Turner did. And otherwise, everything else, which are much more of the active controls with things like social distancing and things like PPE and whatnot, those are very much up to the individual at this point. So point being is we're seeing a really significant decrease in the infection rate. A lot of the protocols have been switched from active requirements and mandates to individual choices. The intention is that the vaccines will continue to increase the reliability of those decreases in the infection rate, and we'll continue to see positive improvements. Of course, that all requires that we don't see significant changes in the virus in terms of variants, in terms of infection rates, and other characteristics of it. But that's kind of the long story short right now, as far as our perspective. Thank you.
Yeah, thank you, Cory. Yeah, we here on campus, we monitor as well, and we've been noticing the very same things that you talked about locally. where positivity rates are low. It's considered basically a low transmission rate right now, but the city is starting to notice and a slight upward trend. So we're starting to really watch that. And we're noticing that our local wastewater is starting to show a few wastewater plants that are detecting a little bit of an increase. And so we're predicting that in the next 2 to 4 weeks, we may start to see some increases. I was wondering, Imelda, are you guys seeing that up at the state level as well? Or what is the state's perspective on current conditions?
Thank you. So for us, looking at the statewide level, I'm happy to say that we have seen kind of a continued decrease in both reported cases of COVID-19 as well as the 7-day positivity rate. And so right now, the 7-day positivity rate is about 2.7% for the state, which is very good. CDC's threshold, for a positivity rate of concern is 10% or higher. Now, during Omicron, this last surge that we had, we did see positivity rates as high as getting close to 30%, depending on the types of tests coming in and things like that. So that is good signs all around. The other indicator that we look at from the statewide perspective is hospitalizations, because that is the one true variable that gives you the whole state and everyone that is in the hospitals. And so both on the state and in the trauma service area that services the Houston and surrounding areas, we have seen declines as well. Now we are looking to see if we're actually plateauing and we're just going to kind of hover here, or if we'll continue seeing a decline, or as you mentioned, if we're going to start seeing, an uptick overall as things are happening. Now, we do know that in Europe, they are seeing a surge in COVID-19 cases right now. And so we're, continuing to monitor kind of internationally to see what that may forecast for us looking ahead. But when we're looking at vaccinations in particular, vaccines are really the best preventive measure that we have. And looking at total Texas populations that have received at least one dose. So over 76% of Texans have gotten at least one dose. So this is over 20 million Texans. So that's a lot of people. When we go down to different age groups, that varies. But one of our recent studies looking at seroprevalence, and so looking at antibodies within the Texas population, over 90% of Texans is estimated to have some level of antibodies against COVID-19. So this is either through vaccination or through natural infection. So that also helps us as well in the long term. But what we don't know yet, because the disease continues to evolve and we're still learning more, is what level of protection is maintained over time and how does that wane? And so as that wanes, as time goes by, and then as new variants come on the forefront, we don't know what exactly will happen, several months from now. And so we just need to continue watching and seeing what data comes in so that we can be ready for any potential new surges.
Yeah, so watching or now knowing that we're not always going to be stagnant, right? This virus is ever evolving, ever changing. We need to have that personal preparation, that institutional preparation to move and pivot with it. So as we're sitting here just post spring break, and we were anticipating a little bit of a bump, but not really knowing where it's going to go. I know everybody's hesitant to make very long forecasts, but can you all give us an idea of maybe in the near term, maybe in the next month, what at your levels, whether at the state or local level, whether you anticipate what you anticipate the pandemic or this virus doing in the next couple of weeks? Are you comfortable giving that kind of forecast, or is that too much too soon?
So I know from our side, we really can't predict what we're going to see. We had anticipated seeing a bigger increase right after, school went back in the fall and things like that. And we didn't see it's too huge of a spike initially. And it really wasn't until after the massive travel events of Thanksgiving and Christmas and the new Omicron variant that, really kicked in around Thanksgiving that we saw the numbers, really change trajectory. And so that's part of the reason why we can't really predict everything. We are actively monitoring all of the data that we have available, and particularly paying attention to what's happening around the globe. With public health, it is very much a global thing. And so you have to pay attention to what's happening beyond just your little community, because of the fact that, and particularly in Houston, y'all are an international city. You have major airports. You have a lot of travel coming in and out. And so that's always something that we should be paying attention to.
Cory, are you guys seeing the same thing locally?
Yes. As far as the actual data, that would there would be a number of different factors in things that had been discussed a moment ago as well, such as hospitalizations, of course, wastewater data and things of that nature. But something that's also important to mention here, in the first question there, I was speaking in general terms as far as the population as a whole, but of course we have different risk groups that we're talking about. So if we're talking about people that are in that higher risk group, such as healthcare providers, specifically people that are working with patients that are either potentially infectious or known to be infectious, people that are providing testing, people that are in those higher risk groups, then of course that's going to require a completely separate set of PPE, respiratory protection, and contamination control requirements and things of that nature. As far as the population as a whole, of course, there's also going to be variables there depending on people's vaccination status, people's personal medical conditions, and the people's personal choices as far as if they're going to be around large groups of people and things of that nature. So to that point, and this was kind of mentioned a moment ago as well, is there's a lot of things that are going to be interesting to see in the coming weeks. For example, here in Houston, not only did spring break happen, but we had the rodeo where we had, 80,000 people a day or more, enjoying that event, which is a good thing. So it's going to be interesting to see as we've continued to increase that reliability with vaccinations and, a much more strengthened knowledge of how to prevent exposures, to see how things continue to evolve. So ideally, we'll see that the infection rate stays low and we continue to kind of improve our holistic defense against the virus. But like we've been saying a second ago, there's a lot of data to be watched there, and there's a potential that things could change. So we definitely want to stay adept to that and be able to adapt as we need.
Yeah, absolutely. So the need to remain vigilant and continue to watch that data, even at the personal level, really is important. So, as a result of that need to remain vigilant, Imelda, I want you to start with the next question. You touched on the fact that the state of Texas really is promoting vaccination as a mitigation strategy. Can you talk a little bit about the effectiveness of our current vaccines in protecting us both from infection or from serious illness resulting specifically as a result of stealth Omicron?
No, absolutely. We are definitely promoting vaccination as one of the key prevention activities that anyone can take in order to protect themselves against COVID-19. But particularly while we're looking at Omicron, so the ancestral strain that all of the COVID-19 vaccines were developed around, while it has mutated, and we do know Omicron is a variant of that, the vaccines have largely held steady and effective against the ancestral as well as Beta and Delta and Omicron now. And particularly when we're looking at those severe health outcomes. And when I say severe health outcomes, I'm talking about hospitalizations and death. And so while we know that we have a lot of data because there's a lot of vaccinations happening all across the globe, that we do see waning immunity over time, and that booster dose does help increase the antibodies within our bodies over time. And so as time has gone by, the data has been coming in, and in particularly with Delta and Omicron, the booster dose recommendation has become more and more important because it does help elevate those antibodies that help protect you against COVID-19. Now, just recently, yesterday, the FDA did give a new authorization for people 50 years and older to receive a second booster after 4 months after they had their first booster. And so that is based on some data that's coming in from Israel, where we see again waning immunity several months out from the last dose. So it's important to stay up to date and stay as current as you can. Now, again, we all have individual situations with our health and protective activities. So for those individuals that are immune compromised, regardless of whether you're 50 or above, they did allow a permissive authorization that allows those that, so if you have an organ transplant, if you are HIV positive, if you're undergoing cancer treatment, have stem cell treatments going on, all of those situations make you at higher risk. And so it is also permissive for you to receive an additional booster dose for that as well. And we know that next week, the FDA will meet to talk through what are the new requirements that are going to surround potential seasonal vaccination for COVID-19. And knowing that right now we're analyzing as much data as we possibly can that's coming in from all across the globe. We know that these recommendations are going to change over time, and particularly with new variants coming forward. Now, both Pfizer and Moderna have announced publicly that they are actively working on new vaccinations that include Omicron variant components of that. And so we'll see how that data shows out through their clinical trials, and ultimately expect later this fall to be able to see if we have kind of a bivalent or a multivalent vaccine the way that we talk about with flu.
Yeah, that would be amazing, right? If we could get something like that.
Mm-hmm.
So let's talk a little bit about those booster doses, whether it's the first booster dose or the second booster dose. It really seems like it's being left almost up to the individual. Should we direct our folks that are eligible for those doses to maybe have those conversations with their doctors about when is the best time or whether they should get this? What would you recommend for folks that are really questioning whether they need a booster dose or not?
So right now, the question about booster dose really depends on your age group and your individual health conditions. But generally speaking, anyone that's 12 years and older, and you're 5 months out from completing the first series. So for the messenger RNA, so Pfizer or Moderna, if you're 5 months out from your second dose, you're currently eligible to receive a booster, the first booster. Obviously, for those that are immune compromised, you are eligible to receive additional doses as well. But the booster dose has really shown to elevate your antibodies back up several months after completing the series. And so if you're eligible, that first booster dose is really, really important. Now, for those that are eligible for the second booster dose, and obviously for the second one, you've had to have your first booster dose.
Yes.
And so, we have a subset of a population that's currently eligible for that now. Again, that's where we would really want you all to have that conversations with your healthcare providers, because the language was permissive within FDA and CDC's language. And that's because the data is still coming in from other countries as far as how quickly that waning immunity happens after the booster dose. And so because we know that we're worried about 50 and older, because they are more vulnerable to severe outcomes from COVID-19, and for those that are immune compromised, that's why they allowed the permissive recommendation to receive that second booster. So if you do worry about that and you're within those two eligible populations, we really want you to reach out, talk to your doctor, and go and get your booster dose.
Okay, very good. Well, I want to direct this next question to Cory. We've talked a little bit about vaccines having a waning immunity. Yeah. Is there data out there available that discusses that waning immunity, whether as far as length of time and effectiveness, and And if there is there some place that we could direct our community to go get that good data? Are there some sites that you would recommend or some studies that you could recommend?
Yes, there are. I will, I can check on the specifics and send that to you offline.
Okay.
But if I may, what I can submit right now is that, to the point that was made a minute ago, there's a lot of variables as far as different risk levels, whether or not there's any vulnerabilities such as medical conditions or vaccination status or being around groups of people, all the way up to being around people that are known to be infectious or handling known infectious materials and whatnot. So when we get into that, if we're talking about, protective measures or exposure prevention as a whole, we have that known methodology with the hierarchy of controls. So the interesting thing about the pandemic is that because it's just a global pandemic, hazard elimination, which of course is always the first step, is literally quite impossible. The closest thing we can do is like a risk transfer by staying at home, where we can't say that we're avoiding it, because somebody could very well go to the grocery store and come home with a potential exposure. But that would be the only way to really get anywhere near that, would be just a quarantine, which we've already been down that road, of course. So that takes us into the next step, which is the hazard substitution. Being that this isn't a cut and dry example like exchanging benzene for a solvent, if we're trying to avoid exposures to carcinogens, the vaccine would be the next step there, because that's going to provide that kind of a abstract substitution, talking about building the immunity through the vaccination. So for that reason, that's a very effective tool in that toolbox. And there's data, like you just said there, as far as the vaccines themselves, as far as the options, the effectiveness, or the efficacy. And then that's also an important detail, is that efficacy is affected by the variant. As far as early on, there was that 80 to 90% efficacy with the original COVID-19, and then now we're talking about 65%-ish with the Omicron. So that's another factor there. And then you've also got the waning efficacy over time. So that's something else to think about. And because of that, and just by the nature of the fact that we know it's not 100% effective, it's not gonna knock out every potential exposure, then that takes us into the other preventative measures, where we get into things like avoiding large, dense crowds and physical separation, having good air circulation and air filtration in indoor areas. And then that gets into the more active measures with social distancing, source control, and then of course your hand hygiene and your surface sanitation or disinfection. But of course the challenge with that is, when you're talking about hand hygiene, that's not going to prevent an airborne exposure. So knowing the difference there is critical at times. It's one thing to have your hands very clean, but if somebody's right in your face, even with a face mask, which is not intended as respiratory protection, there could be an exposure. And then you get into those areas where we know there's going to be a high risk, such as clinicians, people doing COVID-19 testing, et cetera. And that's where we get into the fullest level of the personal protection with the N95 respirator or equivalent powered air purifying respirator or things of that nature. And then of course the contamination control procedures and other PPE and contamination control. So there's a lot going on there, but I just wanted to kind of illustrate that methodology, because that's the reason those vaccinations are so important. And even though they're not perfect, by any means, they do provide that heightened level of holistic protection, whereas the other options are going to be very much active individual measures, such as respirators and just avoiding crowds, things of that nature. So if we want to get that fundamental layer of protection, those vaccines are important. But as far as the data that you ask about, I'll be happy to check on that and send it to you offline.
All right, thank you. I appreciate it.
Thank you.
Cory, you touched on something that really involved the next question that I was going to ask, which is folks really wanted to know about risk factors. And even though the local transmission rate is low, relatively low right now in the Houston area, they're still curious or still, I think, concerned of the likelihood of getting COVID-19 right now for the average person. And you touched on the fact that, maybe individual risk factors are need to be considered, but also the actions, right? The activities that you get involved in. So Imelda, could you maybe discuss some of the more risk-prone actions or activities that folks could get involved in that maybe might expose them to COVID even during times of relatively low transmission rates?
No, of course.
Okay.
So first and foremost, where you're going. And so the larger the crowds and the smaller the space, and more constrained air circulation, you're going to put yourself at greater risk. Even if you yourself are not at greater risk because of your own personal health, but you're caring for a loved one or a family member who is at greater risk, and they are vulnerable either because they're in cancer treatment or have another situation ongoing. Those things, because you're trying to protect that individual and cocoon them around, you want to help adjust what risk you're taking as an individual, because while you may not get severely ill, the more vulnerable person may indeed have one of those severe outcomes. Outdoor activities are much lower risk than, doing things in more confined spaces. Decisions about, whether or not it's appropriate to wear a mask is really based on kind of where you are and what time and space you're at. And so all of our answers that we're giving to you are based on what we know right now and the data we have right now. And so, tomorrow there could be something that totally changes the situation, and we may have a very different answer for you tomorrow. And so I think that's the other piece, is that because COVID is still relatively new, it's important that all of you and all of us continue to stay in contact and listen to what we're hearing from across the globe and from all of our partners in the field. We hear from our locals. We talk with Stephen Williams, the head of the Houston Health Department, all the time to make sure that we are in sync and understanding, what they're seeing and feeling on the ground. And the same thing from us, so that, they see what might be happening in Fort Bend, obviously affects Harris County because you guys are so close to each other. All of those things are really important. And so being able to scale and modify our actions individually are important, because the one thing that has taught us through COVID is all of our prevention activities, they really work. They really, truly do. And so whether it's COVID or flu or some other disease that's come around the corner, the activities that you all have done day in and day out for several years now have proven effective. And so I think that's a piece to remember is, one, know your own risk and those to your immediate family and those close to you. But then two, be aware of your surroundings and know what's happening around you, because that may change what you need to do right now.
Okay, very good. Well, this next one touches on some of that mask wearing. And right now, even though we're in times of relatively low transmission here in Houston, if somebody is fully vaccinated, we've heard the CDC guidance saying, hey, you really don't need to wear a mask. But there in fact are situations where you may want to, because, could you talk about maybe a situation where you would want to wear a mask, even if you are fully vaccinated during times of low risk?
So for healthcare workers, we want them to be protected, and then help cocooning and making sure that we don't have spread within healthcare facilities, because obviously if you're coming into the hospital for something that's not COVID, you are in a vulnerable state, and we don't want to further spread it from there. So those are the first ones that come in. Long-term care facilities that are working with our senior populations, they are very vulnerable as well. And so depending on who you're going to be around, those are situations that, without question, you still really should be wearing a mask, even if you are vaccinated. Now, the location and other types, whether you're outdoors or indoors, matters. But first and foremost, again, it goes to your own individualized risk. And so, for someone that has a compromised immune system, They really need to be more diligent, that even if they are vaccinated, and making sure they stay current on all the additional doses that are being recommended in order for them to be most protected, particularly against severe outcomes. So those are some scenarios. If you're going to be in close quarters with a lot of people, because we know that flu is increasing right now while COVID is going down, flu's going up. And so you don't necessarily want to get that either.
Right.
Those are all things that really should weigh in whether or not you should be wearing a mask.
Very good. Cory, do you have anything that you'd like to add to?
Yes, thank you. One of the most fundamental things in that conversation about whether it be masks, whether it be face masks or surgical masks, and then of course you got your respirators, is just the fundamental difference between the source control and the respiratory protection. So if we're talking about the respiratory protection, the intention is that so if I put on an N95 respirator or a higher level of protection, like an air purifying respirator or even a self-contained breathing apparatus, my intention there is that I'm protecting myself against external contaminants so I don't breathe them in. Whereas if I wear a face mask, like a surgical mask, then the intention is that I'm wearing that to contain my droplets so that I don't project those out into the air. For example, when my children were in the pediatric ICU, then we would wear a surgical mask to protect them from our germs that we potentially would be bringing in from the outside. So that's a really important factor there, because if we're in an area where there's a known high risk, such as people that we know to be infectious, to the previous point, if it's clinicians or people doing testing or whatnot, then if you're within the 6 feet, particularly within 6 feet in an indoor area, especially an indoor area without optimal air circulation, without positive pressure ventilation, then there's a much higher risk. So in that case, the respiratory protection is going to be very much important. Whereas if there's not people that are known to be infectious, but you're trying to make sure that you don't potentially or even accidentally expose somebody to anything, then the source control, the surgical mask would be good there. The big thing also is that we want to make sure that we're able to protect against the particular mode of transmission. So that was what I was referring to a little bit earlier, is that if we have a situation where, let's say we're indoors, we're in a crowded room, and there's not good air circulation, so it's stagnant air and it's kind of sticky, and if you have a lot of people in that room, then if there's a high infection rate, there's a higher potential somebody in that room is going to be infectious. And even if you have good air circulation, that's not going to prevent those potentially infectious particles from being breathed in a crowded room like that. But if you go outside, then there's a much higher chance that those potentially infectious particles get blown away with the natural aeration. So point being is that we want to make sure that, we're able to look for what those risk factors are, meaning that being who we're around. So for example, if we're in a group of people and the infection rate's high, there's a much higher chance somebody in that group's going to be potentially infectious. But if the infection rate's very low, then that risk goes down a little bit. And then we go up to the next level, where if we're dealing with people that may be potentially infectious, such as patients that have an undiagnosed cough or people that are coming to get a test, and then in that case, it's better to go ahead and take those added precautions, because again, if you're in a patient care environment, even if you have good air circulation, if you're within that 6 feet and you're inhaling those particles, then it's going to be an exposure. And then if you have a known risk where somebody is known to be infectious, such as a patient who's got a confirmed COVID-19 diagnosis, then in that case, it's absolutely necessary to use the full respiratory protection, because otherwise, it's almost a certainty there'll be an exposure. So just knowing where the risk is and then how to protect against it is very important there. And that's going to vary depending on the infection rate, depending on the people that we're around, and depending on our status and the individual environment.
Very good. Well, listen, thank you both for suffering through the Inquisition, right? The rapid fire questions. So at this point, I want to transition over to questions from our audience. So folks, go ahead and start putting in your questions into the Q&A section, and we'll go ahead and ask your questions live. So I have one right here. Someone has asked, what lessons or best practices will help our community better prepare for future public health emergencies? That's pretty broad, but maybe think of some go-to good practices that you would recommend. You know, Imelda, let's start with you from the state level. What kind of recommendations or best practices could you provide? Just public health in general, public health emergencies in general.
Well, I think, some of the biggest lessons learned is communication is absolutely key in any emergency, whether it's public health or not. And, given the hurricanes and stuff that you guys have to deal with, y'all know this. But communicating in a way that people understand, communicating at a level that people really can absorb what you're saying in a manner and in a language that they understand is really important. I think we've built a lot of really strong relationships over the past 2 years. We've talked with stakeholders and partners that were not our normal ones, at least on the public health side, because COVID was so all-encompassing, from so many different perspectives. So we've built that. We want to maintain that moving forward. But I think that, one of the strongest things that we've leveraged is social media. Back when I went to public health school, that was not a thing. And communication was much more routine, I'll say. And with the way that people absorb information now, being able to adjust to that, to the way that your community is best going to hear the message is really, really important. We can do amazing things with science. We've come through with new treatments, new vaccines, new testing protocols and testing mechanisms in lightning fashion because the science was able to move through quickly. And as a society in the whole globe, everyone knew they had to share information, so people were submitting their data so that way we could all learn from it across the waters, across political boundaries, across countries. So I think that's really important, that sharing of information has to occur in a timely fashion so that we can all absorb it and figure out how do we change it for what situation that we're dealing with right now. But I think the other piece is that the situation continues to change. And so just because you listen to the message at the very beginning doesn't mean that that's still the message now. And so keeping our communities engaged about what the current situation is important. It's also really hard because people have gotten tired of hearing the preventive messages. People have gotten tired of COVID-19. God knows I am exhausted from COVID-19. I wish I didn't have to talk about it anymore. But, having people tune out from the message, it can have really devastating impacts on our communities and particularly those most vulnerable. And so I think if those are the two things that I would say is sharing of data and communication at the right level at the right time is critically important.
Yeah, I completely agree with that. One of the bits of feedback that I've gotten, especially among some of our younger community members, is that they go get their information from social media these days. They don't tend to read those websites and watch the news and sort of the more traditional communication methods. And so certainly for organizations, right, and institutions, it becomes really important to tap into those social media platforms to be able to validate the data because it's such a jumble in there. It's really difficult, for our younger folks to know what information truly is valid coming from a good source. And so that data validation really is extremely important because I get a lot of misinformation and then they'll ask me and they say, but I read it on social media, right? I read it on Instagram. It must have been true. But maybe mention a few of the good sources for information where they can go to that has where they can tap into those social media programs. So obviously dishes, right? The Department of State Health Services, first and foremost, of course. Any others that you would suggest that would be good for our community to regularly check on?
So there locally, the Houston Health Department has a wide variety of information that's available. The Centers for Disease Control, so the CDC, your question earlier about, vaccine efficacy and data. CDC has a lot of data from across the US and also is publishing data that is coming in internationally. So our website, dshs.texas.gov, cdc.gov has a lot of information, really good, strong information. The Food and Drug Administration, if you're worried about the testing, if you're worried about the treatment stuff, or you're worried about the vaccine stuff, the FDA has a lot of information about the clinical trials. It has a lot of information about the authorizations and what is allowed or not allowed. And so that would be another really strong resource for you all. But ultimately, what you're talking about is something that we're trying to fight all the time. Well, I heard it on TikTok. My daughter had to show me what TikTok was. And so, because someone has a camera and a phone, they are now an expert on everything. And so having the base information, the foundational data source is really important, so that you are hearing from true experts that are highly educated, specialized in these fields. Everything we're talking about is really hard stuff. It's not something that is easy to learn in a short stint. And so, for those of you that saw Cory's long list of education and certificates, it takes a long time to be an expert in these specialized fields. And so it's really important that you listen to the experts when we're dealing with something that's new and scary and is changing our world and changing our lives personally. We want to hear from our experts. We don't want to hear from just somebody with a personal opinion on something. We really want to make sure that we're getting the right information at the right time so that we can make the best choices for ourselves and for our families.
So someone here has asked, can you briefly discuss some of the risk factors for getting a vaccine? I've heard about myocarditis, menstrual problems, long-term immune disorders as a result of the vaccines. How real a risk are those? And is that a bigger risk than getting COVID itself?
Thank you for that question. All vaccines have some level of risk. But the one thing that I can say with the COVID-19 vaccines in particular is the globe has never vaccinated this many people over this period of time ever. And so there are millions and millions of doses of vaccines being administered all across the world. So we have much, much better data than we have ever had. And by far, the vaccines are safe. There are certain individuals that may have adverse outcomes. So that myocarditis, so the inflammation around the heart, has been known with some of the messenger RNAs. But by far, the risk from the myocarditis to an individual is so much less than the severe outcomes that an individual could receive from COVID-19. And so those are the things that at the FDA and the Advisory Committee on Immunization Practices all weigh in. Does the benefit outweigh the risk when they are making those recommendations? And so they're analyzing and getting all that data on those particular events that are happening, because part of what we're doing is we want people to report them, because that's how we get information. And so the vaccine adverse events reporting system is we cast a wide net and try to get everyone to report everything possible. So that way we can sort through that and see what are really true relationships between vaccine and adverse events versus other ones that are not truly related. By far, the vaccines are safe. Now we know that more and more data is coming in every time, but if you are concerned and based on your own individual risk, it's always best to go and talk to your own healthcare provider, someone that you know and trust day in and day out, to have that conversation.
No, thank you. Absolutely. So moral of the story, folks, is if in doubt, reach out to your doctor. Reach out to your doctor, reach out to the state nurses line, but talk to a healthcare professional about your very specific risk, because increasingly that's where it's going, right? Initially there was some very general guidance out there, but if you have that specific of a question, you really do need to address that with your own healthcare professional. So my next question from our Q&A is Cory, this is right in line with what you were talking about earlier about layering strategies and about PPE. Folks out there are concerned about maybe not purchasing the right PPE. So in especially as it relates to masks, what kinds of things should people be looking for as far as when they go to buy a mask? So what's a KN95 mask versus an N95 mask, and what should they be looking for or be concerned about?
It's a great question. So the way that the PPE works is that each individual item protects against a different potential exposure. So, for example, if we're trying to protect against inhaling potentially infectious particles, then that would require a respirator. If we're trying to keep our hands clean, then that would, just be something like nitrile gloves. So the thing about it is that with COVID-19 or influenza for that matter, the highest risk is going to be the inhalation hazard. And if you get it on your hands, for example, if you put your hands on a tabletop that you think somebody may have just sneezed on, it's not corrosive or anything. It's not going to burn the skin. So it's just a matter of washing the hands. If you've been out, this question used to come up a lot back in the early part of the pandemic was, well, what if I ride public transportation or whatnot? We say, well, it's not, the risk is very low. The worst that can happen is that you get some potentially infectious droplets on your clothes, go home, take your clothes off, put them in the washing machine, take a shower, and you're clean. So that particular hazard is not going to be very persistent, but the inhalation hazard is the higher risk, because if somebody's sitting next to you who is potentially infectious and they're coughing in your face, then that's going to be the much higher risk. So point being is that, we want to make sure we have an understanding of where the potential infection is coming from, because the actual droplets or the fomites, if you go by the technical terms there, those are, relatively easy to control. It's just a matter of hand hygiene, clean clothes. If you really want to, and you can use a disposable gown or like a poncho, and take that off and throw it away, and it's gone. But the inhalation is going to be a challenge, because we have to be able to recognize when there's a risk, meaning if somebody's around us and they've got an undiagnosed cough, if you're in a large group of people and the infection rate's real high, if you're in a room with a lot of people and the ventilation's not good or the circulation's not good, then in that case, the options are finite. It's a matter of either a respirator will provide a good amount of protection. It filters up to 95% of the particles down to 0.3 microns in size. So that's really good protection. But the downside of that is it's a respirator. You're wearing a personal air filter, so it's not comfortable. It's absolutely going to affect the air intake. It's, the old cliche is that it's breathing through a straw. And so the other thing about a respirator is that if there's anything breaking the seal, such as facial hair, or if it doesn't fit properly, because it's like clothing. Each model of N95 fits differently. So if it doesn't fit properly, then it'll let in particles, so it decreases the amount of protection. But the good thing is that just by wearing a N95 respirator at all, it's going to protect more than a surgical mask or a face mask. So that's a way to go about that. If you're going to be in a risk area, meaning you're going to be right up close and personal with somebody who's potentially sick, or you're going to be in a group of people and the infection rate's high and you're concerned about that. The other ways to go about it are the easier options, I'll say, and that's going to be, of course, physical separation, just be in a different area altogether. If that's not possible, then distancing, 6 or more feet away from other people. That'll keep you from, being at direct risk. But bear in mind, if you're, 6 to 8 feet away from somebody and you have bad circulation or bad air filtration, then those germs can travel more than 6 feet, depending on where you're at. And so if those things are possible, then that's always a better option, to be honest. But if you have to be in groups of people, if you have to be up close, then the question is, are you up close with people who are potentially infectious? And if so, then really the best way to go about that is a respirator. I see a question. It says, can we break down what's a respirator? Certainly. A respirator is it's a personal air filter that goes over your mouth and nose. So it literally filters out the air so that the air particles that contain those potentially infectious particles, those are going to get filtered out, so you don't breathe them in. Whereas a face mask or a surgical mask doesn't do that. It just covers up your mouth and nose so that if you sneeze or cough, your big droplets don't go flying into the air, but it's not going to filter out other people's particles. They're going to go inside the sides of the mask. So that's kind of the short version of it. But hopefully that was helpful. We can certainly talk more offline, or I have articles about this that I'm happy to share. But that's really the big thing: is you got the inhalation hazard, you got the droplet hazard. Inhalation hazard is either a matter of staying away from people that are potentially infectious or using a respirator. Droplet hazard's easy: just either gloves, take them off, throw them away, or wash the hands, change the clothes, but just make sure you don't have hands that are potentially infectious and they go in the mouth or nose, because then that's going to be ingesting potentially infectious droplets, which can make you sick. But yeah, that's kind of the short version. Thank you.
No, it was a really great answer, Cory. Thank you. So folks, this concludes the Q&A portion of our event. At this point, I'd like to ask our two panelists to just share a few parting words with us before we wrap up today's discussion. Imelda, any final words of wisdom, or if folks can just remember one thing out of today's discussion, what do you want them to remember?
Stay connected to your local public health officials and what they're saying, because they are going to be a trusted source for you, that as COVID-19 continues to change and evolve, as the vaccination recommendations continue to change and evolve, all of that information is important that you receive it, and that you receive it in a timely way. And so I'm so happy that you all are talking with us today. But that can't be the end of the conversation. You need to stay connected, because the information is going to change down the road. And unfortunately, COVID isn't over. While it has declined, and we're all very, very happy about it, it's not going to go away indefinitely. And so we need to make sure that we stay vigilant. We know what precautions we need to take. We know what the risks are, in order to help best protect ourselves and our families and our communities. So thank you.
No, thank you. Cory, last parting words or a final thought that you really want folks to remember?
Certainly. We kind of talked about this a little bit earlier, but the thing that's always been important to me throughout this last several years in particular is that it's not a monolithic single thing that we're dealing with here. It's an airborne transmitted infectious disease, which is the same thing as influenza or any number of other viruses and pathogens that we've as a people, as a country, we've seen in the last 100 years. So knowing how we protect against that holistically is the most important thing there. It's not a thing about COVID-19 or influenza or whatnot. These are all things that are transmitted the same way. So it's a matter of just knowing that we have to know how to prevent exposures to other people, which is your either your separation, distancing, source control. We have to know how to keep from getting the droplets on our skin or our clothes, and then those ending up in our mouth, eyes, or nose. That's going to be your hand hygiene, your surface sanitation and PPE. And then you've got your personal protection for those areas where you're in those high-risk groups, and that's going to be your respirator, your PPE, and your donning and doffing procedures and bio-waste disposal. So if we know what risk group we're in, meaning how close, how much of a chance we have of being around somebody who's potentially sick, and then knowing what steps to take, whether it's stay home, whether it's physical separation, distancing, or whether it's PPE and all of those steps, then we're able to just apply that to the situation, and then we can prevent those exposures. It's all methodical and scientific. It's not the kind of thing where it's subjective and political. But if we're able to just know the principles of exposure prevention and then apply those to the particular pathogen, we're all good. But always happy to help. I appreciate the invitation.
No, absolutely. Well, thanks everybody who tuned in today to our forum. A big thank you to both of our panelists for taking the time from their busy schedules to join UHD and share this incredibly valuable information. Please send any COVID-related health questions to UHD COVID-19 at uhd.edu. There were some really great questions that I did not get the opportunity to get to. We're going to answer those questions and then get those back out to the community. We'll just figure out which form or which methodology to do that, but your questions will be answered. And if you have anything that you didn't ask, but still would like to, again, that UHD COVID-19 mailbox, UHD COVID-19 at uhd.edu. Well, everybody, thanks again and have a great afternoon. Thanks.